Mr. President, I rise today in opposition to the nomination of Ms. Seema Verma to be Administrator of the Centers for Medicare and Medicaid Services, or CMS. As a $1 trillion agency with oversight over Medicare, Medicaid, and the Children's Health Insurance Program, and in addition, state health insurance marketplaces, CMS is providing affordable health insurance to 100 million Americans, including nearly 500,000 Rhode Islanders. Given the responsibility that this post entails of ensuring access to health care coverage for our most vulnerable citizens, coupled with a lack of commitment to fighting back against proposals by this administration and some of my colleagues on the other side of the aisle to dismantle these programs, I cannot support Ms. Verma's nomination to be CMS Administrator. CMS is responsible for a key aspect of the Affordable Health Care Act, the health insurance marketplaces, which provide an avenue for all consumers to shop for the health insurance options that fit their needs and connect consumers with tax credits and subsidies that make the coverage affordable. President Trump and his new Health and Human Services Secretary, Tom Price, are adamant about repealing the ACA and rolling back these benefits. In her confirmation hearing, Ms. Verma was asked multiple times to commit to protecting the ACA for the millions of Americans who are able to access coverage for the first time because of the law, but she would not do so. This, to me, is unacceptable. CMS also works with states and other agencies of the Department of Health and Human Services to ensure that the plans offered on the exchange are not only affordable, but also provide real coverage for when it is most needed. I am concerned with Ms. Verma's beliefs about what health insurance coverage should look like. During her confirmation hearing, she spoke at length about providing consumers more choices about their health care, yet she opposes many of the protections the ACA provides for consumers. For example, she implied that she thought maternity care should be optional. It seems to me that for many families, they would be left with the choice to either pay for maternity care entirely out of pocket, all the while paying premiums and co-pays to the insurance company, or to go without care at all. I don't think that these are the kinds of choices we should be imposing on families. Now, turning my attention to Medicaid for a minute, I am deeply concerned about the Republican proposal to fundamentally change Medicaid and shift costs to the states and to consumers. These proposals aren't new. Year after year, Republicans, often under the leadership of then Congressman, now HHS Secretary Tom Price, have proposed block granting Medicaid, cutting the program by hundreds of billions of dollars. While Mrs. Verma is not yet confirmed, she did express support in her confirmation hearing for this very concept, block granting or capping Medicaid spending. Just this week, we saw a new version of this proposal which simply delays cuts to Medicaid until 2020. In my opinion, this is just a veiled attempt to help gain support for the effort now and then turn around and decimate Medicaid in a few years. In my home state of Rhode Island, nearly 300,000 Rhode Islanders access health care through Medicaid. That's about a third of our population, roughly. Now, that is a significant number for a small state like Rhode Island. And let's break down that number to see who would be impacted by these across-the-board cuts to Medicaid. 1 out of 4 children in Rhode Island gets care through Medicaid, and half of the births in the state are financed through Medicaid. 1 in 2 Rhode Islanders with disabilities are covered by Medicaid, and 60% of nursing home residents in the state get their care through Medicaid. Think about what would happen if this funding is cut, and that is the trajectory of the Republican proposals. States would have to decide among these populations who will get health care, children or the elderly in nursing homes, the disabled or other Medicaid recipients. And if states try to make up the difference, that will result in cuts elsewhere, such as education and infrastructure. Indeed, given the demands for health care, given the tensions between seniors in nursing homes and children needing care, the states will try their best to pull from other areas. What's the next biggest area of state expenditure? Education. Now you'll have pressure on state education budgets. Higher education particularly will be pressured. All of this will be the ripple effect from these proposed cuts to Medicaid. And make no mistake, when Ms. Verma and my colleagues talk about converting Medicaid to a block grant program or capping funding, it's not about flexibility for states. It's about reducing the federal commitment to providing funding to the states. Lastly, I'm concerned about Mrs. Verma's ability to safeguard Medicare for our seniors. Over 200,000 Rhode Islanders access care through Medicare, a benefit they've worked for and earned over their entire careers. I believe that Medicare is essential for the quality of life for Rhode Island seniors and for seniors across the country, and indeed for the children and family of these seniors. In fact, I supported the ACA because it made key improvements to Medicare that strengthened its long-term solvency and increased benefits, such as closing the prescription drug donut hole and eliminating cost sharing for preventive services such as cancer screenings. Over 15,000 Rhode Islanders saved $14 million on prescription drugs in 2015, an average of $912 per beneficiary. And in the same year, over 92,000 Rhode Islanders took advantage of free preventive services, representing over 76% of the beneficiaries. Repealing the ACA means repealing these benefits for seniors and shortening the life of the Medicare Trust Fund by over a decade. Unfortunately, Ms. Verma has little to no experience working with Medicare, and in her hearing and written response to the questions, she appeared to have very little or to no familiarity with major aspects of Medicare. In her confirmation hearing and accompanying documents, she simply has not proven herself to be an effective advocate for protecting these earned benefits for our seniors. We need an administrator for CMS who will work to safeguard health care coverage for children, seniors, and people with disabilities, who will seek to strengthen Medicaid, Medicare, CHIP, and our entire healthcare system. For the reasons I have outlined, along with other reasons that some of my colleagues have raised, Mr. Verma, in my task, Ms. Verma, is not up to this task. As such, I will oppose the nomination, and I encourage my colleagues to do the same. And with that, Mr. Chairman, I would yield the floor.